When you're in pain or recovering from an injury, you may be hesitant to exercise, but as you just heard, Yolanda's success story. So that's why we're joined by David Carroll, a physical therapist with Cone Health Outpatient Rehab at Drawbridge Parkway, to talk about it. All right, so let's talk about why movement and exercise is just so important during recovery, even when you're not feeling so great.
Yeah, so the human body's really interested. The second that we're injured, our body starts to send lymph fluid and different chemicals in to start to try to heal itself. Movement's really important because if we don't move, then those chemicals, the fluid and chemicals start to kind of build up in the joint. We start to develop stiffness, and right away we can start to develop weakness in those muscles. The old kind of acronym that they used to use was RICE, rest, ice, compression, elevation. These days, we're finding that if you rest too much, we start to develop that stiffness and weakness. If you take a knee injury, for instance, if you hurt your knee and we start to shift away from that knee, well, we can end up getting our back inflamed, and we can start getting that joint weakness start developing that joint.
Right? We don't want to compensate with another part of our body, right?
Exactly.
Of
Yep.
course, it
Yep.
feels bad maybe at the beginning when you start going, but eventually it works itself out.
Yep. The quicker we can get back to our normal kind of lifestyle, the better.
All right, let's talk about that. We just heard one success story. Let's talk about maybe some of the success stories that you've witnessed working with patients at Sagewell.
Yeah, I've been here for almost 3 years now. So the really neat thing about Sagewell is I get to see my patients on a regular basis. So we've had several patients come in over the years. We had a patient in the beginning when I first started working here that went through a grueling cancer rehabilitation and was really deconditioned. He came in and worked hard in physical therapy, and now we get to see him on a regular basis. Him and his wife come in, and they're just regular members of the gym. Kind of helped him get back to his regular kind of lifestyle and the lifestyle he wanted. We've had a back patient who had back pain for over 30 years. He came in, was a little skeptical that we were going to be able to help. And, in his case, we didn't maybe get him 100% pain free, but he became a regular member of the gym, and he's working out every day and things like that. So it's really neat to be able to
Yeah.
continue to see our patients in here.
That's good success, and that means that they're doing other things in life that maybe they've gotten back to since all of that is moving better. So what do you say to
Yeah.
someone, though, who is a little bit afraid to move because they think they're going to make the pain worse?
Well, everybody's got a something that they can do. Wherever your starting point is, that's just your starting point. So, even if you're in a high level of pain, if we can find something that you can do, that's something we can start to build off of. With the story that you just heard, the pool is a really great place to kind of start that process. In the pool, you're more unweighted. You can do movements that you might not have been able to do for years. So, there's always some place that we can start with you. There's always something that you can do. And if you wait on that process, it becomes kind of harder to find that point to start. So I encourage people to, as fast as possible, kind of figure out what you can do and start moving forward.
And so we probably don't know exactly what we can do or maybe what we should do. So I'm guessing your first frame of reference is going to be, hey, talk to your healthcare provider.
Yeah, definitely. It's always good if you're not sure, talk to your healthcare provider for sure. If you're healthy and you've exercised before and you've just been out of the groove for a while, you could probably just jump right back in. But if you have an issue that you feel like is real, something that's been lingering around, or if you have other healthcare issues like heart disease or high blood pressure, diabetes, you definitely want to probably consult with a doctor first, or your practitioner or
Okay.
medical professional.
Well, you're at Sagewell and they specialize in all kinds of medical fitness. How is that different from going to a gym or doing workouts on your own?
Yeah, so medical fitness, what we've tried to do here is kind of blend the both worlds together. So your medical wellness and your general fitness, they really do go hand in hand. We've tried to put everything kind of in one building, and we did that for two reasons. One is convenience. So, everything that you would theoretically need for the most part is here. The other is communication. We talk to our doctors on a regular basis, our primary care doctors. We have a really close relationship with our orthopedic providers. So we're able to really communicate, you know, up and down the chain. So for instance, if say you sprain your ankle, you can come in. We have a same day orthopedic clinic. he can take a look at you and say, hey, you need to see our orthopedic surgeon, or maybe it's time to go down to rehab. Once you come to rehab, what we can do is kind of build you back to whatever your fitness goals and your life goals are. And then our health and wellness specialists, our trainers here, they all have degrees, mostly in exercise physiology, and they see a lot of the injured
Hmm.
patients that we see after, and we can transition right over to them. So that's really the medical fitness model, is kind of everything all in one self-contained place.
Right, and then
And then
everybody talks to everybody instead of you going over here and then waiting a week to go over there and whatever else. Okay, we're going to continue this
exactly.
conversation about how to get back into exercise after an injury or a surgery. We're going to take a quick break though and check in on the forecast.